Our cholinergic antagonist, our parasympatholytic, our anticholinergic antimuscarinic drug, and they will use all these terms interchangeably: anticholinergic, antimuscarinic, cholinergic antagonist, parasympatholytic. It all means the same thing. The most important drug that you can understand, the most important drug that you can describe with the anticholinergic drugs is atropine. Atropine is a belladonna alkaloid, one of the belladonna alkaloids. So atropine is our anticholinergic, antimuscarinic. It's a cholinergic muscarinic antagonist. Anticholinergic, antimuscarinic, parasympatholytic. And this is what confuses everyone, because you'll read something that describes atropine as a muscarinic antagonist, you'll read something else that describes it as antimuscarinic, or something will describe it as anticholinergic. You might see something else that describes it as parasympatholytic, and all of those terms mean the same thing. So atropine is one of the most important drugs that you can understand as an acetylcholine blocker, anticholinergic. So atropine will be used to speed up heart rate. Remember, this is the system that slows down heart rate, so blocking that system will speed up heart rate. The parasympathetic and sympathetic systems are opposite, so if we block one, we'll have the same effect as an agonist of the other. So atropine speeds up heart rate just like epinephrine does. Epinephrine is sympathomimetic, mimicking the sympathetic nervous system. Atropine blocks the parasympathetic nervous system, so it also speeds heart rate up. So atropine is used in the emergency treatment of bradycardia, brady slow cardia heart rate. Atropine is also, in the old days, it was used to dilate pupils. Atropine causes mydriasis. Mydriasis is pupil dilation. Atropine and the belladonna alkaloids will be used for diarrhea. In the case of diarrhea, the bowels are excited and moving too much. We can use atropine to slow the system down. We're blocking the system that speeds up the gastrointestinal tract. Atropine is used as the antidote for organophosphate cholinesterase inhibitor poisoning. Organophosphates are cholinesterase inhibitors, so they're cholinomimetic, raising acetylcholine levels. And when that gets to be a toxic point, we can use atropine as the antidote to block the muscarinic receptors from toxic acetylcholine levels. So you'll notice that sympathomimetic drugs will have similar effects as anticholinergic drugs, antimuscarinic drugs, sympatholytics. So we can use beta agonists in asthma, like albuterol, but we can also use anticholinergic drugs as bronchodilators as well. So sympathomimetics are bronchodilators. Anticholinergic drugs are bronchodilators as well. And in combination, they'll call this DuoNeb. It has two drugs in the combination. One of the drugs in DuoNeb is albuterol. It's a beta-2 agonist. It mimics the effects of epinephrine on beta receptors that are sensing the sympathetic nervous system and its instructions. And so albuterol is sympathomimetic. Ipratropium, which is Atrovent, is anticholinergic. It's antimuscarinic and parasympatholytic. It's blocking the system that's constricting lung airways and increasing secretions. And so by blocking it, ipratropium is also a bronchodilator.